Good morning and welcome to the COVID-19 Forsyth County updates. We are so appreciative of your attendance here to this meeting, a presentation that will be made by Mr. Joshua Swift and some of his colleagues at the Public Health Department right here in Forsyth County. We thank you for joining us on today. Love Out Loud in the Ministers Conference of Winston, Salem, and Vicinity have been working hand in hand over the course of this time where we had been stay at home by feeding people, providing masks to others, and now we want to come together and provide this information through our Public Health Director so that we have more in-depth information about the do's and don'ts and what we need to prepare for as it pertains to COVID-19 right here in Forsyth County. And so we thank Mr. Swift and his team for joining us today to provide this information. There is an agenda that has been provided to you in the chat box, and we will follow that agenda accordingly. And so without further ado, I'm going to put now the opening prayer into the hands of Reverend Chuck Spong and to introduce Mr. Swift to give us his presentation. Thank you again for joining us.
Good morning, everyone. Good to be with you all in the middle of a crisis, but also in the middle of so many people joining together to affect change. And so we're grateful for the many people on this call. I'd like to, as you all are well aware, both the Ministers Conference and Love Out Loud come from a Christian perspective. And if you'd allow me, I'd like to open with prayer over our efforts that we might just kind of settle our hearts a bit and enter into this of one mind. So God, we thank you for this day, a new day that is full of your mercy and your love. And we pray that that would be a part of our conversations. God, we also pray for courage and boldness to address inequities and injustice in moments like these where things become just so radically clear as we see injustice right in front of our eyes. Thank you for the many people that run from the grassroots up into the C-suites that are engaging on these issues. We pray that you will guide our conversations. May our words be full of grace, but also full of truth. And we thank you for this time together. Amen. Amen. I just took a quick glance at who's on the call, and I just want to give you a sense for kind of, as we like to say in creative terms, who's in the room. And it's very encouraging to see people like Jerry Mosley from Faith Health, our friend Dr. Allison Matthews from the Maya Angelou Center for Health Equity. I see Rhonda Mays always carrying the torch with Forsyth County Association of Educators. Asia Pepper for Partnership for Prosperity. I see city council members as well as county commissioners. We want to thank all of you for your ongoing efforts in many of these spaces that we'll be talking about along the issues of both how we respond to COVID-19 as well as in a greater sense to some equity issues that we would want to address even as we're addressing the immediate needs at hand. So thank you for being with us. And I'm sure there are many other community champions out there, as well as just grassroots heroes that really carry this work forward on a daily basis. This morning, we're grateful to have Joshua Swift anchoring our talk. Joshua, you see his name quite a bit, of course, in the papers because of giving us daily updates. I got to know Joshua actually serving our community back when he first arrived. He and his family were part of some efforts to help kids get back to school. And I can speak for his heart for our community that transcends or supports the work that he does vocationally. Joshua is the Public Health Director of the Forsyth County Department of Public Health. And he and his team have been just working nonstop. Often they have a job that the scale of which is quite dramatic, and while they may have funds that seem very significant, they do just some very heavy lifting with funds that often don't match the need that they address. So we're grateful that Joshua was willing to bring us an update on where we're at here in our county, to bring us some facts and how we might engage in this issue. So Joshua, we'll let you take it from here.
Okay. All right. Can everybody hear me? Okay. Well, thank you, Chuck, for the introduction. and it's great to be here. I will say, one, this is a team effort. Nathan Ward, our food and lodging supervisor from Environmental Health Division, he is here. He has been our liaison for houses of worship. And I wanted to have him on here to show some of the work that he has done to do outreach to our churches and religious organizations in the community. See a lot of familiar faces. I see Alan Younger. Was it 2 nights ago? We see each other on the Greenway at Muddy Creek. I saw, obviously, like I said, Chuck. I've worked with Chuck. I see Mr. Willard Bass out there, and just a lot of individuals out there. So glad to be here and have this time to share some of what we're doing and how we're trying to move forward. So, okay, wonderful. So this is a brief update of this COVID-19 for Forsyth County. And I see Ms. Robinson from the city, from Neighbors for Better Neighborhoods. I see her in my screen. So, hey there. Okay, so we'll start. So this basically what we're going to cover, a little bit of history, looking at our case counts. We'll show you some of the resources we have available on our website as far as surveillance, talk about some of our outreach efforts, discuss testing, and look at next steps. And those next steps will include, Nathan shared some of the guidance that he's worked with a lot of our churches on as the churches reopen, since we have a lot of church leaders on the call. So history. So really late December, the 1st of January, we heard of this virus in Asia. We had our first U.S. case in Washington State on January 20th. So January the 7th, we conducted a meeting with our Forsyth County partners to discuss then what was called the novel coronavirus that was on the west coast of the United States and also throughout Asia. So, this is nothing that is, we have dealt with pandemics. A lot of people forget about how in 2009 there was the H1N1 pandemic. But anyone that got their flu shot this year, H1N1 was a strain of one of the strains that's in that flu vaccine. So it's become, normal. Obviously, there's some differences between that pandemic. It was, I don't believe, quite as contagious and as widespread. And we didn't have the media attention, and really, I don't think the ability to know how widespread it could be. So this is something new for us. But we had started to have conversations about this in February, early February. Then March 3rd was the first case in North Carolina, and then March 11th, our first 2 cases of COVID-19 in Forsyth County. At that time, what you were hearing was of people that had been traveling to Europe or to Asia, and it was brought back here. So that's just a brief history. Today, since March 11th, now today is June 11th, so I believe it's been just at 90 to 91 days that we've been going. So it seems like it's been 900 days, but it's only been 90 days that we've been doing this. So one thing just to clear up real quick, because in the media, there was some, and social media, which is playing a role, there was some misconceptions. All cases and deaths and recovered persons that we report through the Department of Public Health in Forsyth County are Forsyth County residents. This mostly came up when we had the large outbreak at the Tyson facility in Wilkes County, but we actually had 70 to 80 employees of Tyson who work in Forsyth County. They either work there or their family members work there. So, there was people thinking, well, those people must have come to Winston-Salem to get tested. Well, no, it's where you live. It's not where you get tested. So, excuse me. Sorry about that. So, anyway, the other thing is that all of our cases are laboratory confirmed. This is not, I saw Dr. Rachel Zimmer, Dr. Rich Lord are on the call, and I'm not the doctor, I'm not an MD, but I know that sometimes if it's in the middle of flu season and everybody in your family has flu and you have the same symptoms, and they can agree or disagree. Usually, okay, yes, ma'am, yes, sir, you have the flu. But, or you've seen 20 people like that today, okay, maybe there's no need to do the test. But all of our cases of COVID-19 are laboratory confirmed. Now, that could be a rapid test. That could be the nasopharyngeal, where is very invasive, so those are those tests we're talking about. We're not talking about the antibody test, which that's a whole study that's going on. I know Wake Forest Baptist Medical Center and the School of Medicine are working on that, and you hear about that in the news. But this is the laboratory confirmed test of if you have it now. So when a person is confirmed, we contact them, and then we reach out to their close contacts. So that's for a while, that's been people that you're within 6 feet of for 10 minutes. Now that's expanded the time to 6 feet for 15 minutes. But just think about in mid-April, when everything was shut down, it was mostly, for most of us, if we're still going to work, it was those we were around at work and our families. But now as that's expanded, and which we need to open up our economy, but it's become tougher because we're around more people. We also instruct those persons to self-isolate for 14 days. So in the perfect world, when you're dealing with something like this, and we deal with things where we have, whether it's tuberculosis or hepatitis A or hepatitis B, on a smaller scale, we find the person, have them isolate, then find their close contacts, and you're able to snuff it out in a way. You're able to put the fire out before it gets out of control, if that makes sense. So I'll move on. I didn't mean to go into an epidemiology class there, but just wanted to share a little bit of that. So our case count, I just went by, since I made this yesterday, obviously March 10th, we had no cases. There was just a half a dozen in the state by that time. April 10th, so look at from April 10th to May 10th, it was very small increase, 90 cases. But look at the drastic jump from May 10th to June 10th. Basically about May 15th or 16th is when it drastically increased. So we have, so I just wanted to share that with you. I thought that was interesting, going back and looking at those numbers. So surveillance report, and I'm gonna, so this is on our website through Forsyth County, and I don't know if you can see it. It's our daily case count, and then it goes into our North Carolina cases, then deaths, and the amount of testing. So I'm going to try to just quickly open this up, and I assume everyone can see what I'm looking at. And then this is a report. So that basically this shows, we are very blessed in Forsyth County through the Department of Public Health to have an epidemiologist, Dr. Lavette Miller. She is worked with the CDC. And so I will just, this is on our website, so I'm not going to read this verbatim, but you can see so far as of June 7th, 16,647 residents have been tested for COVID-19. It's roughly 4.5% of the population. Total residents who have a positive result, and again, this is a few days old, was 1,822, and then the percent of lab tests that are positive is almost 11%. Then you have a breakdown by gender, by age, and by race. And you can also see we have a breakdown of our deaths. At the time of this report, we had 25 deaths, which we have been very fortunate to have had a fairly low death rate compared to some counties in the state. You can see that broken down. And then this gets a little bit into a little epi speak here, but table 3 shows our cases per 100,000. So our rate of cases compared to other counties, other peer counties, larger counties, Durham, Guilford, Mecklenburg, and Wake. And the best way, and again, this is all available to show it, is just showing our trend of our rate. And as you can see, March, April, early May, we were actually trending below the state rate. So we had an uptick in mid-May, and for the first week or so of that uptick, it just brought us to level with the state at about May 18th. But since May 18th, our numbers have continued to rise per our rate, per 100,000, right, at a faster clip than the state. Again, we get this, Novant and Baptist Hospital graciously supply us with information for the case counts and the number of testing that's done on the other tables. And we try to put this all together once a week, usually Monday or Tuesday, unless there's a holiday. And then this last piece I would show you shows our hospitalizations and how that was hovering in the 20s. And again, this is hospitalizations of just Forsyth County residents, how that number has increased. It's still pretty stable. And again, I see that there's some Dr. Zimmer and Dr. Lord are on the call. We work with them. We work with Dr. Ohl, Dr. Priest through Novant, and Dr. Pam Oliver. So just information on that. So now I will try to go back and let's see. Oh my, hold on one second, please. Can we see the slides again?
Not yet.
Oh, so it went away?
Yes.
Sorry about that. Sorry about that. How is that? Better? Good.
Yes, sir.
Okay.
You're there.
Okay, so sorry. Is it back again?
Yes.
Yes, we're there.
Okay, so you can see the outreach, I hope. Okay, so next I want to talk about in mid-March when schools were closed, we started a outreach by taking the school nurses and repurposing them. And we created liaison groups to work with these following organizations: homeless shelters, working with our food pantries, our Spanish-speaking population, long-term care, child care centers, the detention center, and Nathan, who is on here, Ward, as outreach to our faith community just in the last few weeks as churches have now been able to reopen in the community. So testing, I know that is a discussion, and this is something we're working with the Division of Public Health on, because there's some miscommunication even from that Division of Public Health doesn't know about, that we currently have 21 testing sites up in Forsyth County. They only knew that of 9 or 10. So we're trying to make them aware, make the public aware. This is on our website as well. And I hate to click this. I hope I do this correctly, but you can just see. Come on.
Mm-hmm.
There's more than just Kernersville. My apologies. I don't know what. I'll just go with the health department. So you can, like just that, I don't know if you can see the dot and the circle, which it's showing all 21. So that's the 21 testing sites that we currently have in the county. Those are through Baptist, through Novant. We have had 3 CVS facilities come on board, 3 FastMed urgent cares, United Health Centers has 3 sites, and community care clinic. Also in the last week, Highland Avenue Primary Care Center, which is a partnership with Baptist and Novant, has started offering testing Monday, Wednesdays, and Fridays. So if I can get back, I hope we're back. So our goal is to try to fill in the gaps where testing is not available in the community, especially focused on areas that are historically marginalized. We're really trying to focus more on especially 27105 area, that zip code, because there's a lack of a permanent or just testing in that area. But so we'll also show, and maybe you can see this, is just a look at, and this is from May 31st, so it's a week old, but showing the testing sites, which are the yellow dots, and then you're seeing, this is what's called a heat map. So basically the darker the red shows the more cases in the community. And so you can definitely see the Kernersville area. You can see East Winston, Waughtown, out towards Louisville and Clemens. in those areas. So that is something we are, and that's a reason too, we like to see positives and negatives so we can see where people are positive, but we can also see where people have access to testing. So next, you can see this is a list of the amount of COVID-19 testing. So this is the amount of people that have been tested in their communities, in these zip codes. So 27045 is actually Rural Hall, which is only 3,200 people in that zip code. So it's kind of an outlier because it's such a low number. But then when you look at the other zip codes, 27105 actually has 5.4%. It's the second highest percent of the population tested so far in the community. Then you go to 27051. I don't have it on me. I believe that is Walkertown. I think, I don't know for sure, but so you can see the amount of testing by zip code. 27107 is 4.6%. The zip code that I'm sitting at, 27101. And at the time that this chart was made, the average was 4.2%. So we have some of our, especially some of the zip codes that are outliers that have less. I will just note, and this is something I learned, 27109 is actually a zip code assigned to Baptist Hospital. Did not know that till this, but so obviously assigned to a place of employment. So there's been low testing of people there. So next, just what are our next steps? So obviously with public health, we're trying to do two things. One is trying to focus upstream and trying to work on how we can go into the community with these liaison groups. We're working on setting up peer educators that can go into the community and try to focus on prevention, try to focus on education. So ideally, we want to prevent people from getting COVID-19 if they can, to take steps as much as possible to prevent it. But then we want to conduct strategic testing in the community in those areas to fill in those gaps. Like I said, we're not saying, the great partners with our FQHC, our free clinic, our Novant, and Wake Forest Baptist Medical Center, but trying to see where we can work together or do on our own. We have a lab, a piece of lab equipment. It's called the Hologic Panther. It's pretty state of the art compared to other health departments. And we're working to get it online to where we can do testing in the community, where we can go out and do rapid tests to a group or at an event at a center, so we can do that. Because I do see in the coming, until we get a vaccine, which could be a year to a year and a half, I see this, now is primarily in the Hispanic community where we've seen the drastic uptick, but I think this is going to be a moving target that's going to go throughout our communities, and it might cycle back through. So we got to be able to be nimble, but it takes a while to get the processes and the equipment up to standards where we can work with the state. And I see Rich Lord shaking his head because it is very hard to get set up. And then another thing that I've heard from both hospital systems is the supply. We have basically 3 or 4 contracts in the works, and we're going to keep those in the works with different lab companies, because today one might have a supply, but I have no guarantee that tomorrow or next week they'll have that same supply. So we have to have these, shuffle them around. The next piece, and this was primarily, as we wrote this, was geared towards faith leaders, but this could be anyone, but develop plans to protect your members at your church or your house of worship, or even at your work site. What are things you can do? I think it's been really neat to see how people are creative people can be. I mean, obviously, now you see the plexiglass, you see the tape markers where we, stay 6 feet away, the hand sanitizer. Some of this stuff we should have been washing our hands more anyway. So some of this stuff is really neat to see, and how people are doing things. When you go to a drive-through, it's in a a box and they hand it to you so they're not touching it. I mean, just really some neat stuff. But the other piece is trying to provide reliable information to your staff and to the members of your church, because that is the thing I see more than other pandemics I've worked through. And, you know, I've been in public health 15 years, so I've been through H1N1 and Ebola and West Nile and different things that were pretty intense at the time. One is the length of time that this is going on is more so than I've seen in others. But two, with the internet, any of us on this call, if we have an opinion about COVID-19, we can find someone to verify that on the internet. And it could even be a doctor. I mean, I've heard some crazy stories of doctors in different places that say something, and if that's what if that is your bias, people will latch on to that. So, you know, we are really pushing CDC, DHHS. You know, those are really solid sources of information. So next, I saw Nathan, he was up there. I wanted to invite Nathan Ward, supervisors in environmental health, to come on and share some of the best practices that he has seen with, you know, from the faith community that he's worked with, and share some of the stuff he's doing. And I'll change the slides when you need me to, Nathan.
First of all, let me say it's just an honor to be able to work alongside you as we open back up. I'm serving on our church's board as we open back, so we're kind of learning as we go. It's a learning process type of situation. But when I was asked to be the liaison, I thought it was really an honor, and I'm enjoying getting to meet people out in the community through this process. But I tried to figure out, where do I need to start when I was contacted about how to get this information out to people. So where I first started was, I said, let's contact the Winston Chamber of Commerce and get a list of faith-based organizations that are registered with them. So as I reached out to them, they gave me a list of over 500 facilities that were registered with them, and also some community partners that were registered with them. And so what I did was I started with the community partners as part of this outreach to push this information out. Some of the community partners, and Josh, if you'll advance that slide, I think it may be the next slide. Yes. Some of the organizations we reached out to that I pushed the information out to, and I did this via the email. If they had an email, tried to send that through email. We're looking at the Ministers Conference in Winston-Salem, the Hispanic League, Habitat for Humanity, Forsyth County, Winston-Salem Chamber of Commerce, Second Harvest Food Bank, and Love Out Loud. I also reached out to Dr. Goldie Bird over at Wake Forest Health Disparities to try to push this information out to their contacts first. I thought if we could start there and kind of start getting it out under that envelope, it would be a good way to start. And then I started working on the actual list of individual churches and organizations that were registered on the list from the chamber. I started out by going down each one, and if I could find an email or a web address, I sent the information through that web address. And I ended up was able to get to 274 of those organizations that way. And then the other ones, we just had to do it the old-fashioned way of standard mail. So I got their mailing address, and then I started just stuffing envelopes. We mailed 200 to 263 organizations that way, for a total of 537 faith-based organizations have been contacted. It took a little over a week to do it. It's quite a task to try to get the information out, but we did try to push the information out as quickly as we could so that people could start looking over the guidelines as they began to open up. Okay, if you advance it to the next one. These are the this is what we pushed out to everybody. And these are great sites that you can get some helpful information as you decide to open back up. These are the CDC guidelines. The first two links are the CDC guidelines. The third one, I think, is the best guideline. It is the North Carolina Division of Health and Human Services interim guidance for places of worship. That guidance has a checklist that you can go back down step by step to develop you a plan to reopen and put the components that you need into your plan to make that plan the safest. Some of those highlights as part of that plan, I did want to try to go over a couple of those highlights. One of the main things you're going to want to do as you decide to reopen is to have some type of an emergency plan, an emergency contact list, so that you know who has attended your service. And I say that because if you do have a case or a contact that ends up being positive that has come to the service, you're going to need to be able to get that information out to your contacts as quickly as possible, so that they will be able to isolate and really prevent the community spread that you're talking about, even within the household. So that's really, really important to have that information up to date and know who's attending the services. So if you do have guests that are coming and that you don't typically have on a regular basis, you would want to try to get them registered if you can. If you can get some contact information for them, that'd be good, so that you can call down if you have an issue. The three main things that I'm telling everybody as part of their plan is the 3 W's are big. And that is waiting 6 foot apart, waiting or worshiping 6 foot apart, maintaining that distance, wearing masks. And then, if people don't have masks, it's a great idea to go ahead and have some available so that you can put those on the congregation as they come in, and to wash hands and remind people that hand washing is the most important thing they can do. Also, hand sanitizer stations with the 60% alcohol, at entrances, exits, so that they can have that just in case they've touched anything that would have recontaminated their hands while they're in the service. One of the things also that's great to do is to post signage, the Know Your W's. When you look at that third document there, that DHHS document, as you go down that, it has hyperlinks within the document. So when you click on those hyperlinks, you'll be able to get posters, things that you can post that informs the public of really symptoms they shouldn't come in with, and the Know Your W's, and also proper wearing of mask and laundering of mask, and how they should do that, and also how they should remove the mask. Those are all good information for the people to have as they come in, and by informing them that, they understand. And some churches are actually doing screening. So it really depends on what level you want to do this. Some are doing temperature checks as the individuals come in. They're only registering so many people for the services. So it's different degrees depending upon how they've instituted their plan. But another thing you want to make sure you're doing is disinfecting high-touch surfaces. And within that document, as you get down to the disinfectant component, if you click on the disinfection, you'll be able to get an EPA site where you can put your particular product you're using to disinfect in to see if it is effective against COVID-19. So there's ways to look up EPA numbers. There's ways to get that information to check it against what the EPA says is effective. And then one of the biggest things that's come out recently that has helped the faith-based organizations is movement and airflow through the facility. So if you can create air either by fans or opening windows, you create a positive pressure, gets the virus particles out by blowing cross drafts across. So there's ways to do that, and it's all talked about in that guidance document. I did want to hit those different highlights there. We've been working so far. I have been fielding calls from people, emails from people. There is my contact information there. If you guys need to reach out to me, you can reach out to me individually. I've also gone out and actually visited some of the churches that wanted me to come out and take a look and see kind of how they're setting up and what they're doing. Let's talk through the process. So I'm available for that as well. And my contact information is there. I have had some churches that have sent me their plan, and then I've read over the plan, and we've added some components to that plan that have helped them to be able to reopen safely. Right now, people are just they're a little bit scared of it, so they're opening up very slowly. Some have decided to stay online all the way through to the fall, and some houses of worship did not close, and then some are just now starting to reopen back up. So it's kind of a trial and error process. We're trying to see kind of what works, but this guidance that I was telling you about today, those are the basics that we need to be sure that we are following so that we stay safe out there. But I'm happy to look at any plan that you have. I'm happy to meet with you. If you would like a meeting with me, I'd be happy to do that. And again, my contact information is there. I gave you both my desk phone and my mobile phone in case you need to reach out to me. I may have to start incorporating other individuals into this if it gets to where the workload gets to where we need some additional coverage, but we can take care of that as we need to. But again, I'm honored to work with you, partner with you. And if there's anything I can do to help you, feel free to reach out. I'd say the information that we passed out to everybody is those links. I sent those links out to everybody, and if you didn't get those, they're here. If you need posters and you don't have access to computer, or you need me to mail them to you, I can do whatever you need. But I'm looking forward to working with you, and if you have anything that you need, please reach out.
Thank you, Nathan. Thank you very much. Great work. And as I shared with Pastor Covington, I'll be sending this presentation out with all these great links and information. So, really in closing, obviously we're opening it up to questions for myself or Nathan. And obviously we got the 3 W's, like he said. And again, this is Public Health Basic 101. We already have talked about washing our hands and using hand sanitizer during cold and flu season. And the 6 feet apart. Obviously, I think the mask is a little bit new to us, but in other countries it's pretty common for people to wear a mask. And something I would say is, especially with the cloth face mask, and this is something we've tried to push, is when I wear the cloth face mask and you come near me, that protects you. And so, I really, it's, looking out for your neighbor and helping those looking out for others. I think is very important, and to me, it shows that you care about someone, and it's the right thing to do. But we're open for any questions or comments or discussion.
Mr. Swift and Mr. Ward, thank you so much for your presentation. We're going to give just a couple of minutes to Dr. Rachel Zimmer. After that, Jeremy Mosley with Faith Health. Before we do the Q&A, I am writing down in the order that they are coming in the questions that are already prepared for you. So at this time, if we can hear from Dr. Rachel Zimmer.
Hey, you guys. So yeah, and to further confuse everybody, I'm actually a nurse with a doctorate. So how's that? So I'm going to share the space a little bit with Dr. Lord too. I'm just going to speak specifically to the program that I lead, which is Community Health Alliance. And that is a program that I started last year. And the program actually provides primary care at no cost for people who don't have health insurance in the community. And also I've started a food prescription the last 2 or 3 months, and we deliver food to community members who are food insecure, and that could be families or older adults who are homebound. So that's what Community Health Alliance is. The mobile clinic is a vehicle and can be used as a tool. We use the mobile clinic to go into sites to provide primary care for people at no cost. So I just want to kind of clarify that. And then we have historically gone into the Hispanic community. So we go to Iglesia Cristiana Sin Fronteras, which is Pastor Daniel Sauceda's church. And then we had just started going to see patients at Morning Star Missionary, which is Pastor Leach's church. I just saw her on here. And then also we have been providing care at the homeless shelter, which is on Trade Street. So that's historically what we've done. We had to close because of COVID, but we've been doing telehealth visits even while we haven't been physically present in the community. And I know that there's some questions around more specifics, but I wanted to kind of at least lay that as a framework to help you understand what the program is. And then I was going to shift to Dr. Lord just to maybe speak a little bit more toward strategy.
Yeah, thanks, Rachel. And I appreciate, can y'all hear me okay? Mm-hmm. So, appreciate the opportunity just to talk for a few minutes, because Rachel has done a great job in the mobile primary care space. And I want to link in some of the testing, since I knew Joshua, he and I have been talking. We had a call yesterday. There's a lot of activity going on around testing and sort of what's happening at Wake and sort of our philosophy in general. And one of our strategies has been, Rachel and I have talked about it a lot, is as we partner with community organizations, we believe that partnership informs and lets us serve in and with the community in a different way. And I'll just share a couple ways that's going on. That School-Based Health Alliance, many of you may have heard of that. It serves about 4,000, 5,000 visits a year in Title I schools across the city. That lives, and the infrastructure of that lives in the Department of Family and Community Medicine I lead at Wake, but it's not out there as Wake Forest, but it exists and uses the mobile unit. And why do we do that? Because it has a community board that can direct what goes on. It's closer in the community than I can be. United Health Centers used to be Southside. our department worked with a community organization to get that started and have continued to partner with them. And we have folks that are in each one of the sites that Joshua mentioned. And we're continuing to try to partner because their problem with testing right now has been getting swabs. They're waiting to get swabs from LabCorp. And so we're trying to figure out, do we have some at Wake we can get out so they're out in the community? And so we look to try to create things that are sustainable, just as Rachel's doing with the mobile unit. Where in the area can she develop sustainable relationships that go on for years? So the School-Based Health Alliance has been 20 years. United Health Centers has been open now for 11 years. Highland Avenue is the most recent one that we're working with the community, different partners with the county, with 2 health systems that has now been open just a year. So it's our newest one. And we want to continue, and I want to bring that to the group, that both Rachel and myself, the institution, are looking to figure out how we partner within the community, not just us coming in. My thing has been, we don't want to be doing stuff to the community. It's with the community and helping them direct us. Where we sit with testing right now is trying to work with the health department, allowing them to be the point person. As Joshua talked about, I fully agree. They're going to be pop-up spots that we don't know where they're going to pop up, and we're going to need to have people that can move around. And how do we partner? One of the things we're making sure we partner, and just for everyone on the call to be aware, at the testing centers that we have, all those ones, the United Health Centers, the Highland Avenue, the one that's over on Peacehaven Road, people will be seen irrespective of ability to pay. There is no question about insurance. If you have it, we'll file with your insurance. If you don't, we see you. We do an assessment there because we also don't want to miss all the other disease that is impacting our communities, and particularly the underserved communities that have a higher risk of all the things we know about. So I just wanted to share that philosophy. I'll leave it there, but we're working with the health department. We're going to continue to try to partner. That's how we got the Highland Avenue. Was kind of, Joshua talked to us, and then Novant and us came together and said, let's get it there. We'll be looking for those other areas where we can figure out where can we bring the testing, both in a sustainable way long-term, which will be more, because it is going to go on this winter. We're going to have all kinds of people getting sick with the flu and other colds, and we're going to have to know, do you have COVID or not? And then how do we partner with Rachel with the mobile unit, and how she's partnering with the community to get primary care into the community and learn those pockets of, do we need to do Novant and Wake, do we need to bring another site at some point in the future in a different area of the city? So that's sort of our philosophy right now, is really trying to partner with the community. Be the first one to tell you we don't do it perfectly by any stretch. I've not met anybody that's perfect, except, at least if we read in the scriptures, one person, but not anybody that I work with nor myself. So I'll stop there and leave it for questions. And Rachel, I don't know if you had other things.
No, I think that's it.
Thank you so much for your presentation. We appreciate all the information that you have shared thus far. We do have some questions, and we are up for the time for Q&A. And so I would like to begin with the first question that came in was from Paula McCoy. Her question is, where are the test sites located in East Winston? There is the impression that there are none.
I can start this. I mean, obviously, when you look at, and I don't have the list in front of me, but when you look at the website that I shared, and I think it's already been shared on the group chat, and I'll be sending it to you, Pastor Covington, to share to the group. I know for a fact in the 27101 zip code, I believe you have the new Highland Avenue clinic that Dr. Lord was talking about, that's now open Monday, Wednesday, and Fridays. You have a community care center on New Walkertown Road, which is the free clinic there. Dr. Pete Roby is their medical director, and he's on the Health and Human Services Board. Then you also have, I believe, one of the United Health Centers, 3 clinics, is also in that zip code as well. You have in the 27107, you have the clinic that Novant has stood up at Watown. You also have Little Bot, which is a medical clinic that is on, I believe, maybe Sprague Street or Watown, that is primarily focused on the Hispanic population. We have met with Gabrielle Gabriel is their director, and he's with the Hispanic League. And I also believe in the 27107, there is one of another one of the United Health Centers clinics is in that area. In the 27105 is where we see the largest gap. We have the CVS and a Fast Med have stood up, but they're on the periphery over in that University Parkway area. So that's where we're looking at trying to do some pop-up sites. Ideally, we want to, in the next few weeks, we would like to do something because the county has a library, Carver School Road Library is in the 27105, and we would like to be able to stand up something there, hopefully by late June, where we could do some testing periodically there to try to make it more available. We are seeing, as I showed in the slides, that in the 27105 and the 27107, both of those have over, I forget the exact number, but they have still have a high percentage of people that have been tested. That's not to say that enough testing's been done, and I know that there are barriers with transportation and access, but we are seeing, thankfully, a high percentage of people tested in those areas.
Mr. Joshua, can I push on that just a bit?
Yes, sir.
Like just to pull up the map that you referenced, because this is the concern of the community right now.
Mm-hmm.
Yeah, so just going off your map, it's just, I mean, I'm just speaking on behalf of the community. It's dramatic.
Mm-hmm.
So I just searched by 27105, yeah. And it's just dramatic what is lacking north of 421 and east of 52.
Yeah.
And the heart of what nationally, statistically, would be where high percentages of cases will be. I also like the percentage. It was interesting that you noted that rural Hall, it spiked, kind of be an outlier with a small population. So I just took that premise, and when I just Googled what's the population of 27105, which is 5.4% tested. That's a huge population. That's 40,000 people.
Mm-hmm.
So of those 40,000, that would mean just a little over 2,100 have been tested. So I don't want to get in front of everybody else, but I think this is the question on the minds of community organizers and neighborhood associations in our vulnerable communities, is this sense that there is a higher percentage in these communities, but we have not tested enough to affirm that and to address it.
Yes. Thank you for bringing that up, Chuck. And you're right, that is on our radar, and we're working to try to get more testing in that area. And one example of this is CVS. We learned from the state that CVS was going to open up 3 facilities in Forsyth County, and this was a statewide rollout where they would do testing. They came to me. They said we were going to open them up on Robin Hood, Coliseum, and Country Club. And I said, hold on. How about the one right behind Health and DSS at North Martin Luther King Drive? They said, well, we'll see what we can do. So then I followed back up. I've been following back up with them consistently. The latest I've heard is they hope that maybe that could be in late June. I have heard that another one has opened up at University Parkway, but I've pushed for the one on at North Martin Luther King Drive, almost directly behind the health department. And there's one in the southeast part of the county, the Wahlberg, near that area, not far from Watown. So yeah, I don't, no doubt, you're right, that there is a lack of testing facilities in that area. I think that the struggle that we're having in public health is, working to do the contact tracing is so labor intensive. We literally have, there's 100 staff that are working on the contact tracing. 30 are probably outside of the health department, but we're using staff on that, and then we're trying to, in the coming months, we're getting pressure from the state, actually by July 1, to keep doing immunizations, to keep doing family planning, to keep doing all of these normal things that we're supposed to do. But I have heard recently that Novant maybe is looking at a more a permanent location, and we definitely want to do more testing in that area, 27105, because it's glaring. Like you said, I'm looking at the map that you're sharing, and it's a glaring deficit.
Thank you, Joshua. And again, I point back to my original introduction of Joshua, that the county health department does incredibly heavy lifting with, not nearly enough funds. And so my hope would be that there'd be partnerships, as you mentioned, between providers and other institutions. So thank you for your work, Joshua.
Yeah.
Oh, thank you.
Chuck,
Thank
can I
you. We still have several questions that have been put in the chat box. If we can leave room for our audience to have their questions answered. The next question is from Latoya Robinson. There may be some disadvantages experienced by other communities which may affect their abilities to get to and fro tests throughout Winston-Salem. Is there currently a schedule or route in place to get in the underserved communities? If so, and who has the schedule? How can we share with residents in other neighborhoods that may not have access to the internet or social media?
I would just say we're working obviously to get the word out about those testing locations, and as soon as those are firmed up, that we know that we can get that out. I mean, we don't want to give a date and then have to reschedule, but like I said, we're looking in late June to be able to do that testing, and we will be able to and that's a great point. We want to be able to send that out not only through social media, but through our churches and other community partners, because we have seen in some of our communities, like with our Hispanic community, a lot of our, we've done social media, but it's just posters and information that's put out there where people can see it, and trying to make it as accessible as possible.
Thank you. The next question is from Melinda. The question is, do you have to be referred by a physician to be tested?
How about I let a physician answer that question?
Yeah, these at the current time, I know for the CVS sites, you either need a physician's order or you have to go on their website and go through a screening form, and you can get it without. At the assessment centers on Monday, Wednesday, Friday, no, you can come up in your screen to determine if testing is appropriate and you need to get the test. So you do not have to have a physician's order at the sites. They will screen you to determine whether or not you need it. At some of the sites, they ask that you just call and you can come in for that evaluation to get tested.
Thank you. The next question is from Charlotte. Can the percentage of false positive and negative with testing be shared?
I'll just say for us, I mean, we've worked with both hospital systems to get the total number of tests that are done. So that's where we see that 16,647 residents have been tested. As of June 7th, that was 1,822 positives. So that's right at 11% of those tested were positive. I'll refer to Dr. Lord. I don't know how you would report false negatives or.
Yeah, the difficulty right now, I understand the question, how many people are we missing and that really have the disease, and how many people are we telling you have the disease when you don't? That's a function of how many people in the community actually have the disease and the test that's used. And unfortunately, since we as a nation didn't choose one test like Germany to do across the whole nation, as Joshua mentioned, at Wake, we have 3 or 4 different platforms plus LabCorp. Novant has 3 or 4 different platforms plus LabCorp and Quest. And then the health department has the Panther platform, so that trying to report those out in any meaningful way is almost impossible. We feel probably the best, you're going to miss out of 100 people. If everybody had the disease, doing a perfect swab in a perfect day, you might miss about 10 of them if you miss them, even though you've tested them. So about 10%. And that's pretty great for a medical test. Most of the time we never get near there. But the importance of, to Joshua's point, that most of what we're going to gain for the benefit of our population is the 3 W's, the waiting 6 feet apart, washing your hands and wearing a mask, because no test will be 100%. We sometimes have repeated tests days later to find that the first one was negative the next one's positive. We've also had the same thing where somebody got tested, they had no symptoms, they were positive. We test them the very same day or the next day and they're negative. But it's hard to do because of the variety of tests we're using. I wish they give you better data.
Thank you. The next question is from EKTAPATEL 18 at Hotmail. The question is, can health department share a resource on how to laundry clothes face covering so we can send that out to our staff and families?
I will look into that for you. I mean, myself and my family, I mean, we put them in, wash them in warm water and dry them, just like we would, regular laundry. I would advise, something we have seen is we would advise people not to share masks because, when you're wearing that mask, that is not a good practice to share it with someone. Another thing I would say as far as mask, you don't really need, in my opinion, to wear a mask when you're just outside walking on a sidewalk, unless you're around a lot. If you can social distance, you should, you don't necessarily need a mask. But I mean, myself, whenever I go into a store or at work here, if I go into the break room and I'm going to be around people, put the mask on to protect myself and others.
Real quickly, the other option as well, if people had a series of 3 masks, the virus does not live long on cloth. So if you just set the mask down after you've used it that day, let it sit for 2 days, the viruses are going to be dead. So that if people are worried about wearing the mask out, if you're washing it too much, the fabric and stuff will break down. That's another option that some folks are actually doing is but not all of our folks in town have 3 masks. So I agree with you, Joshua, the warm water and soap, and then otherwise, if you let it sit, if you can.
Thank you. The next question is from Maria. How can we help reach and inform the Hispanic community?
That's a good question. We have, ever since March, we have taken 2 individuals. One is a doctor, Dr. Reina Rodriguez, who's from El Salvador, and Nohemi Campos, one of our Spanish-speaking nurses, and they have been working boots on the ground in the community. They've reached out to over 200 Hispanic businesses and organizations. But I would say the thing that we would say going forward is we still got to keep continuing that education and working with employers, because we have heard some rumors that employers will not let they're making their staff come to work even when they're sick. And people have to work. All of us have, we have to work, and we need, but the biggest thing in addition to those 3 W's, the way to stop the spread is for people when they're sick to stay home. So we need employers on board as well as the leaders in that community.
Thank you. We're going to take just a few more questions, and then we're going to leave space for Jeremy Mosley. He is on the agenda, and we wanted to get to the questions very quickly. So we're going to give you 2 more questions, and then we'll come to a close of this meeting, which has really provided a lot of information. And I know you all have shared your contact information. If you have not already, put it in the chat section so that some of the audience can reach back to you with any questions and concerns that they may have as well. The next question is from Leah Show. What about contact and tracing? When will we have enough? I lost that. When will we have enough? Oh. Leah Show, can you unmute yourself and ask the question very quickly, please? I lost it while others are putting questions in the chat box. Pastor Leah Show? She may have gotten disconnected.
Okay, I've unmuted myself.
Thank you.
I've read that North Carolina currently has fewer than 500 contact tracers. Some experts say that a state needs 5 to 15 contact tracers per daily positive test. North Carolina health officials reported over 1,100 new cases on last Thursday. Does anyone know if there are plans to expand this number of contact tracers? And thank you.
Okay. I can just say that we have, right now, we are working with the state and their pool of contact tracers. to have 30 contact tracers from the state, approximately 30 to 40 from other county departments, and then internally, so we have a team right now of 100 staff between the health department, Forsyth County government, and the state to work with contact tracing. And I know that they are continuing to hire more staff as they see this expanding, because this is definitely a need and it is very important. I will even say, some people have said, I've heard Dr. O make the statement that, really the contact tracing is just as important or maybe more important than the testing, because the testing, we could all 85 or 100 people that are on this call could be tested today and be negative, but that's no guarantee that we don't go to the grocery store afterwards or to a family get together and a few of us get infected and 5 days later we're positive. So, but the contact tracing is important. We have a team, and the state is taking this very seriously and providing more help because we need it.
Thank you. The last question to Mr. Swift: what is the status of efforts to arrange testing site at CVS on MLK in New Walkertown?
Yes, as I stated earlier, I have reached out to them multiple times and continue to make sure that they're aware of the need in the community, and especially the need to offer testing at that CVS facility. I have provided them with the address of that facility and even the store number, and advocated for the fact that that is an area of high need that is very important and would for the community based on this location. So I can promise you, I can't promise that it will open, but I can promise you that I will continue to advocate for that location to be a testing site.
Thank you very
Madam
much.
President?
If we have Jeremy Mosley on, if you have a couple of minutes, we've already come to very close to our time to close, but I do want to give you space to speak to the initiative that you all are working on before we close. This has been recorded, and so we will have this available and share it with Love Out Loud to upload it on their platforms so that everyone could obtain this, and we will share it through email as well. Thank you so much to all the presenters, all of you that signed on. We want to thank our elected officials who have joined on as well to this conversation. There are still a lot of questions that need to be answered, but thank you for making yourselves available to provide contact information so that we can reach back to you. At this time, Jeremy Mosley, before we close with prayer.
I'm sorry, can you hear me?
Yes, sir, we can. Thank you.
Thank you. I apologize. I'm still struggling with technology. Let's pray. Lord, as we come to you, we know that our communities are suffering, particularly our African American and Hispanic brothers and sisters. We pray that we can all come together to seek immediate solutions with your wisdom and with your guidance to help our communities overcome not only these short-term issues and challenges, but the long-term health issues that impact our communities. We pray that we can look beyond our organizations and that we can seek a vision of community that involves each of our hearts and each of our minds. We pray these things in your name. Amen.
Amen. Thank you so very much. We appreciate all of you that joined on today. Thank you, Mr. Swift and your team for coming on. Thank you, Rachel Zimmer, for joining, and all others. We look forward to connecting and learning more about how we can help heal the city together. Be blessed.